Welcome to the Center for Latin American and Caribbean Studies at Indiana University, and welcome to this webinar, COVID-19 Pandemic in Latin America, an Interdisciplinary Perspective. I'd like to welcome the participants in the audience and the panelists as well. My name is Cesar Felix Brazefer, Interim Director of the Center for Latin American and Caribbean Studies and Professor of Hispanic Linguistics in the Department of Spanish and Portuguese. This panel takes a fresh look at the impact that COVID-19 has had on 5 regions, 5 countries in Latin America: Brazil, Paraguay, Peru, El Salvador, and Mexico. I will begin by introducing the 5 panelists, who will share their perspectives on that the COVID-19 has had in their regions. And I will present them according to the order of their presentations. Andrea Siqueira, faculty member of Brazilian Studies at Indiana University, the Hamilton Lugar School of Global and International Studies. Welcome, Andrea.
Hi, thanks.
Manuel Cáceres, ambassador from Paraguay to the United States. Ambassador Cáceres.
Good afternoon, a pleasure being with all of you. Thank you for the invitation.
Welcome. Rubén Ruiz Guerra is the director of the Center for Research for Latin America at Universidad Nacional Autónoma de México, UNAM. Rubén, welcome.
Good morning. Thank you for the invitation.
Miguel Rodríguez Montoñedo is professor of linguistics and Spanish at Pontificia Universidad Católica del Perú. Miguel, welcome.
Hello. Thank you for the invitation.
And finally, Oscar Martinez is a journalist from El Salvador and co-founder of the online newspaper El Faro. Oscar, welcome.
Hi, it's an honor. Thank you for the invitation.
As we all have seen in the news, and according to recent news and the Pan American Health Organization, Latin America is now the epicenter of the coronavirus pandemic. Latin America has surpassed Europe and the United States with more than 2.4 million cases and more than 143,000 deaths. Brazil is now the country in Latin America with the highest number of infections, making it the second country in the world of daily infections after the United States. The countries trailing Brazil in the number of confirmed cases include Peru, Chile, Mexico, Ecuador, Colombia, the Dominican Republic, and Argentina. Now, with regard to Central America, I was reading an article this morning in the online newspaper El Faro, and they have a nice overview of the current situation of the pandemic in Central America as a whole, but also they have nice updates for each country. And it was interesting to see that Panama has the highest number of confirmed cases in Central America with over 11,000 cases, followed by Honduras with over 4,500 cases and nearly 200 deaths. This panel addresses the following questions. So all these presentations will address the impact that the COVID-19 pandemic has had in Latin America. And this is the structure of the panel. Each panelist will have 15 minutes to present. And at the end of the last presentation, we will start with the discussion. Please, this is for the members of the audience, please feel free to send your questions or any comments that you have during the presentations. I will be collecting the questions. Then at the end of, during the session, the discussion session, I will ask these questions to the panelists. You can send the questions to everyone or just address them to specific panelists. So please feel free to send your questions through the chat feature. Also, 2 of the 5 presentations will be delivered in Spanish. The one by Oscar Martinez and Rubén Ruiz. If you wish to listen to these presentations in English, there you have the interpretation icon at the bottom of the Zoom panel. So please make sure to select the language English. That way, you will listen to the translation. There will be online translation. So again, for these 2 presentations, you can hear the translation in English. Let's begin with the first presentation. And Andrea Siqueira, our first panelist. Andrea Siqueira is faculty in the Department of International Studies at Indiana University, where she teaches on global health and environment, human rights, and health and rights. Professor Siqueira is a social cultural anthropologist, and her research focuses on rural and urban populations of the Brazilian Amazon, gender, health, environment, food studies, social movements, and human rights. The title of her presentation is COVID-19, a portrait of the Brazilian lack of governance and its social and health inequalities. Professor Siqueira?
Okay, thanks again. Thanks, Cesar and Clax, for putting together this panel in this moment that unfortunately Latin America is the epicenter of this pandemic. And Brazil is very high. We have high, as you have mentioned, we are second highest number of cases behind the US. And in terms of deaths, is the 6th place in the world. We have, as of today, we have 26,000 people who had died of coronavirus. Also, it's important to remember that these numbers are official numbers, and the stats are showing that at least, they're 7 times greater. In reality, they are 7 times greater than these official numbers. And we are not even in the peak of this pandemic. The peak is predicted to be between early and middle July. And there is also prediction by the University of Washington and with other organizations in Brazil that we are going to have about 125,000 deaths by early August. So we are talking about a lot of deaths and consequences of this pandemic, social and economic consequences of this pandemic. I just want to give a very brief view, and I have to say the numbers I'm going to present here are also changing as we speak. I'm really following really close the numbers and reports about what is going on in Brazil, but it seems like if you read one thing in the morning, in the evening, there's different numbers, but those are, what I'm saying, this is as close as to updated as possible. What I would like to say that just a brief panoramic about Brazil is that our first case was identified, it was early February in São Paulo. São Paulo City, as you know, is the largest city in Latin America. In Brazil, is about 12 million people. And the first group of individuals who had present coronavirus, they are from the upper middle class, those who are coming from Europe from their vacation. So February is the first time that we have identified the first cases in Brazil. But soon it spread to all corners of the city, São Paulo city, but also to the interior of the state and other parts of Brazil. So right now, coronavirus is everywhere around Brazil. In north region of Brazil, despite the numbers, the highest numbers, the greatest numbers is still in São Paulo city, in São Paulo, or the deaths and the case, north regions of Brazil where the Amazon region presented the highest, are the most affected region of Brazil. So the other thing I want to make sure, or just to remind, and this is important point to make, that the number of deaths, Black and brown people die in great numbers than white people in all age groups. Coronavirus has had killed about 26,000 people, about 7% of them are individuals 60 years or older, and with some underlying health conditions. But also this has affected, 30% of those who had died of coronavirus, they are younger than 60 and they didn't have any kind of underlying conditions. Again, the numbers are much higher than I'm presenting here, but those are the official numbers that we have so far. So I think it's important to remember, and for those who follow Brazilian news or follow what is going on in Brazil, this is nothing new what I'm presenting here, but I think it's important for us to think about that. Right now, we are facing this crisis. This is a health crisis, economic crisis, but also a political one. As you know, Jair Bolsonaro is the president, he's a far-right president. He was elected in November 2018, And he continues to deny the severity of the situation. He keeps calling it is a little cold, you know, like he really is just continues defying social distance policy imposed by local governors. He is confronting the local governors all the time in terms of their policies in place, trying to social distance, as we know, is one of the measures, public health measures that needs to put in place if you want to curb the evolution of pandemics. He continues to participate in political rallies with public. He also has dismissed 2 health ministers in the last 2 months because they could not agree with him in terms of social distance. And about 2 weeks ago, his new health minister really got out of the minister because he could not, again, agree with the protocol that Bolsonaro wants to implement, well, actually he already done, as implementing use of chloroquine as the medical procedure for the cure. He keeps saying about cure of coronavirus. So, and right now, there is another thing that's important to keep in mind. He has an interim Minister of Health who is a former general, who has no knowledge in public health, and militarization of his government is something we are observing as well. So it's important to have this in mind when you're talking about this health crisis, which in Brazil is not just a health crisis, but also a socioeconomic crisis and an environmental one. And we know that burden, you know, this is not new, burden of this pandemic, and it's not just in Brazil, it's not evenly distributed, right? The risks and burden is not evenly distributed. Brazil also is a country with a high socioeconomic and regional inequalities. And this crisis, this health crisis really highlights them, you know, our inequalities, socioeconomic and also regional inequalities. What I would like, you know, I could expand this for other, you know, talk about gender inequalities. There are so many inequalities in our society, but I would like to call attention to the vulnerability of 3 populations in Brazil right now. One is the urban poor, the other is the rural population, rural poor, and indigenous population. So that's what my focus. I'm going to give you some panoramic what is going on, especially in terms of urban poor, rural poor, and indigenous population. And then I'll talk a little bit about possible solutions, which I have to say that it's really hard to see possible solutions right now. There's a lot of initiatives addressing these issues in Brazil, but I think the challenge is how to address these inequalities. We know that these groups are more vulnerable now. They are, and after the pandemics we have seen is historical as well. If you don't, depends on the kind of intervention that we have, government intervention policies in place or not have, also is going to affect them. So they are vulnerable now, and they also can be much more vulnerable if they survive this crisis. So what in terms of what I think this pandemic really highlights in terms of urban poor. So just to keep it, just to take the example of social distance and hygiene, wash your hands a couple of times during the day. Why do you do this when most of people live, not most people, but a large number of people, there's about 10 million people that lives in what we call favelas, shanty towns in Brazil, or communities that really lack sanitation or access to clean and safe water. The other thing that is important to keep in mind, Brazil has a housing deficit of 72 million houses. This is data from 2018. Or also we have to take into consideration that urban poor, many of the urban poor work in the informal sector of the economy, which means they do not have any kind of a safety net and how can you even be home, working from home if your work is informal. You don't have any kind of a safety net. You cannot work from home. So those are very are challenges. There are challenges not in Brazil, many places, but this is a huge challenge in Brazil. The other thing that's important to keep in mind, and this is intersection of inequalities in Brazil, 2 times more Black and brown people live in favelas or in these communities than white people. So this is not just a class issue, all the things I'm talking, but also there's a dimension of racial issues. So not only there is more Black and brown people dying or being diagnosed with coronavirus, but also they live in areas or with most of them with a lack of access to sanitation, water, or health services as well. So this is one dimension. And this applies to Brazil in different areas of Brazil. So the other things that is important when you talk about inequality in Brazil is in terms of health service. And this also highlights not only the urban challenge to provide health service to everybody, but regional and rural populations, how there is a variation on that. So Brazil, as you may or may not know, has a universal healthcare system, and we call SUS, Sistema Único de Saúde. 70% of the population exclusively dependent on it, it's dependent on these health services. Only 30% of the population has any kind of a private insurance. However, these services that SUS varies a lot, depend on zip code and the region and the state, and even within the state, there's a huge variation among the municipalities. So I want to give you some idea in terms of what are available there. Doctors, we have in Brazil, we have about 500,000 doctors, physicians, it's not lack of physicians. Overall number of doctors vary from region to region, rural to urban. There's 2.8 per 1,000 people in the southeast of Brazil, which is the richest region of Brazil, and less than 1 doctor for 1,000 population inhabitants in rural areas, especially in the northeast and north of Brazil. So in many rural areas of Brazil, including the Amazon, the region where we work, what do we do? We have these healthcare deserts. There's no doctors, there are no even what you call healthcare center. So they are really, if you're sick, there's nowhere you can go, or you have to go by boat or by road, 2 or 3 hours to get the care you may not be able to receive. So despite one of the things, when you talk about numbers of doctors in Brazil, we see that most doctors are concentrated in urban areas and capitals, and most work as private clinicians or in private, or accepted just private insurance. So again, despite the good numbers of doctors in Brazil, what we have an uneven distribution. In terms of hospital beds, this varies from south region to north region. South and southeast region has more beds, hospital beds, than northeast regions, but none of them, no region in Brazil, this is important to keep in mind, are below. No regions of Brazil has the recommendation that is 2.5 beds, hospital beds for 1,000 inhabitants. Even São Paulo, if you think in terms of aggregate numbers. And what we have been observing in the last 10 years, despite of growth of population, the numbers of beds had decreased by 40,000 beds, hospital beds. So it's the same. We do the numbers of intensive care unit. Just 50% of them are in public hospitals or public service. More than 50% are in private hospitals. So, and when I say that is north region of Brazil, that is facing the highest numbers or of coronavirus, is not surprised that many of the public health are closed with maximum capacity, especially the North and Northeast region. And is just to, is in North region of Brazil that encompasses 11 out of 15 cities with the highest prevalence of disease right now. And this was a recent, was a report by the University of Pelotas in Brazil, who just released this number a couple of days ago. So the areas, again, is affecting everywhere in Brazil, but some areas have much less capacity to take care of the patients than others. So, and the other thing, in rural, and especially in this group, rural population are very, very vulnerable. And some of them, because they live in conditions, like that is very poor conditions as well, and very far away for any kind of a health care service. Last but not least, I want to call attention to issues of indigenous people in Brazil. So indigenous people in Brazil, they have been affected a lot with this health crisis as well, but also for other policies in place by the Brazilian government. They are not affected, there's several indigenous groups, ethnic groups, they are affected differently. But there are the ones isolated, and the ones in close to urban areas somehow are the ones that are more affected right now. Well, and why I say that? Because there is this current government too has been day one of his government. He's really trying to dismantle any kind of a protection, environmental protection of the Amazon or other regions of Brazil, and also really wants to decrease the numbers of indigenous areas in Brazil. So, and he's very encouraging invasion of indigenous territories by miners and farmers, which put them, especially more secluded an indigenous population in contact to minings or loggers, illegal loggers. And as you know, this can lead to another genocide of this group. So it's not the first time that Brazilian indigenous people are facing kind of genocide, but the kind of encouragement that government is doing right now really can lead or is leading to deaths of indigenous people who are isolated or in their territory when he encourages the invasion of their land or cut funds for any programs that give indigenous people health service or programs that really make sure that their territory is secure. The other group of indigenous groups that are very affected as well are the ones living in urban areas. Like nowadays there's about 35%. This is, numbers vary, it depends on report and study that you see, but it's a large number of indigenous people, especially in the Amazon as well, in the Northeast, that live in urban areas. And the conditions of these indigenous people in urban areas are very similar to the urban poor. They live in crowded space, with participating in the formal, informal economy, and in very precarious situation. So we see, and again, this is just, I'll be glad to talk about all these groups of individuals, other forms of vulnerabilities as well, but just to give you some idea what are the challenges, for the population as a whole, but for specific groups of population. So what I think what are these a crisis brings to us is like, I think it's not new that parts of the population are really are suffering more, and they are really carrying the burden of this crisis. You can see Zika, dengue, HIV/AIDS has long highlighted Brazilian inequalities, but I think the big question is like, how you do get out of this situation? And I don't think this is not a simple question. It requires a new social contract in society. It's one that is a urgent one that reaffirms the norms and principles of democracy. I really think this is something that, in addition to everything that we are living, this economic and political crisis, we are also, there's a threat to democracy, and any kind of coming back to normal, and here is quote unquote, we need to address the roots of inequalities in Brazilian society. I think this is a big challenge, is we need to address development that are inclusive, also one that takes in consideration the environment, and one that really address the inequalities in our society. So that's my view. There's no way we can come back as business as usual, or I would like to think, this crisis also would be an opportunity to rethink our models of development and how we include, make a society more just society. So I'll stop here, and I'll be glad to have a conversation and answer any questions you may have. Thank you.
Thank you, Professor Siqueira, for such an interesting talk. I'm sure we have more time to elaborate on some of these issues during the discussion session. So please, this is a question for the audience. If you have any questions, please send them to the chat feature. I am pleased to introduce my second panelist, Ambassador Manuel Cáceres. Ambassador Cáceres is a current ambassador from Paraguay to the United States. He has occupied key governmental positions, including Vice Minister of Foreign Affairs and Vice Minister of Economic Relations and Integration. Ambassador Cáceres has served as Paraguay's ambassador to the Federative Republic of Brazil, Argentina, Belgium, and he has also been honored by the governments of Argentina, Brazil, Ecuador, Mexico, and Peru. Ambassador Cáceres, his presentation is entitled Policies of the Government of Paraguay Related to COVID-19. Thank you, Ambassador Cáceres.
Thank you very much, Professor Cesar Felix. It's a pleasure being with you and with the distinguished list of panelists today to address this issue that's really took hold of our daily routine in a way that nobody really thought about it, nobody really expected. And here we are. I'm here to discuss a little bit what we did in Paraguay, what we're doing. When I talk about Paraguay here in the United States, I always try to sort of put people into perspective, size, population, and GDP. So we are the size of California, population of Arizona, and the GDP of Rhode Island in the United States. So I think that always helps to put things in perspective. And of course, we are neighbors to Brazil, Argentina, Bolivia. Brazil as itself, it's as big as the US. So people sometimes when look at the map down there, things look so small. We had the size of Germany, by the way, when you look at the map in Europe, Germany looks so big, we look so small. But those things are just to put things in perspective. Regarding the situation in Paraguay and in the region as a whole, of course, we are very concerned. This really has changed how we do our everyday life. And Paraguay took this crisis very seriously from the beginning. Once the second case was confirmed in Paraguay back in March 11, the government reacted very strongly. We closed our borders, schools were suspended, people had to stay at home, and in a way, it paid off from a health point of view. Why we took those measures? Of course, the government was concerned. Paraguay, just like my Brazilian colleague was talking about, the health system in Paraguay is not an ideal one. We have few hospitals, and the government was very concerned of the implication. There were projections of tens of thousands of people dying or getting infected, and in the meantime, the government built 2 hospitals. Our capacity is very limited, but those things paid off in a way that up to date, Paraguay has 900 cases. Of those 900 cases, we have 11 people who have died. We have more Paraguayans who died in New York, 15, than in Paraguay as a whole. And we have 150 people with infected in New York. We have 900 in Paraguay. But talking about those 900, about 70% of them came from mostly Brazil. Paraguayans trying to return to Paraguay, and all of those are in shelters. So actively in Paraguay, we have about 300 cases, and we already have most of that people that have recovered, and the rest are their homes. But the big number of people in Paraguay are in shelters. Although Paraguay is a young country as well, it's one of the youngest in Latin America, as you can imagine. Due to that, 44% of people infected are ages 20 to 30 years old, 20% from ages 10 to 20 years old, and 17% from ages 30 to 39. Most of them are located in Asunción and the surroundings, and also on the border with Brazil. Paraguay is closest border with Argentina, with Brazil, and with Bolivia. So no flights coming to Paraguay up to date. We only have charter flights in which bring Paraguayans from abroad, and we cannot travel abroad. It's a complicated issue, and people are going to come to Paraguay. As you can imagine, that also took a toll on the economy. We had to, we don't have the resources that other countries have, and also Paraguay is a high percentage of informal economy. About 30% of people are self-employed, and closing all the economic activity really creates lots of difficulties and challenges for what comes ahead. And my Brazilian colleague was talking about social inequalities. Of course, as being part of this part of the world, that's very much in day-to-day life as well, with all the challenges that poses. And we have issued bonds, tried to come up with about $1.6 billion to for payments for people who lost their jobs. And we came out with sovereign bonds in New York at a 10-year bond for 4.9% interest, which at this time the crisis, it's a remarkable numbers. So there we are trying to do what we need to do. And the biggest challenge now ahead of us is how to come out of this and reassume the economic activity. We have started different phases, and we are in the second phase of recovery, starting to loosen up a little bit and to see what we can do and how we can recover. Economic projections for Latin America are not good for this year. Most countries will have a negative growth. Paraguay, I think, is the second country with the lowest negative growth. Actually, Dominican Republic is zero growth, and we have a -1 GDP for this year. If you compare that with other countries in which have 4, 5, 6, and even higher percentage, we are doing fine. But of course, we, as a developing country, you want to grow every year. We have been growing 4 or 5% per year in the last 20 years. We have brought down poverty by half. We have doubled our middle class, and we brought extreme poverty to single digit. So this is a pause in that growth period that we have enjoyed for such a long time. And we, of course, are also members of Mercosur, working together with our neighbors, trying to coordinate positions. Brazil, everybody's concerned about how things are going in Brazil. We wish that things go better there, and with the federal government working with the different states in Brazil, we hope that the situation gets better. But it is a concern. Numbers are not good around the region, but we will just keep doing what we're doing and trying to keep up those numbers. So that's a vision that I wanted to share with you about Paraguay. And of course, I'll be willing to talk about more if you have some more questions. But basically, I'm here to not talk too much, try to answer questions and listen and learn from all of you. Thank you for this opportunity, and well, looking forward to the discussions that will come up later in the afternoon. Thank you.
Thank you, Ambassador Cáceres. This is such an interesting talk, and I'm sure there will be connections between your talk and that of Brazil and the other regions. So thank you so much. I've been receiving some questions from the audience through either the Q&A function or the chat. So whatever is easier for you, please send them to me Some of you are sending questions directly to my email account. So whatever works for you, please send them to me. But I've been receiving good questions for the discussion later. Let us continue with the third session. I will now present Ruben Ruiz Guerra. He is the director of the Center for Research on Latin America and Caribbean Studies at the Universidad Nacional Autónoma de México, UNAM. Professor Guerra is a historian of religious diversity in Latin America. He has conducted research on international relations among Latin American countries during the 19th century. His book on the relations between Mexico and North Andean countries was the first written survey on 200 years of history. The title of his presentation is COVID-19 Challenges in Higher Education in Mexico. As I said at the beginning of this webinar, his talk will be delivered in Spanish. So if you wish to listen to this in English, please select the language to English. Professor Ruiz, welcome.
Hola, buenos días. Muchísimas gracias por la invitación, César. Muchísimas gracias por el privilegio de estar compartiendo tiempo y espacio con ustedes. Mi presentación se llama Los retos que plantea el COVID-19 a la educación superior en México. Voy a hacer una presentación en 3 partes, 2 muy breves y una un poco más larga. Las 2 breves tienen que ver con la situación general en el país a raíz de que llegó la pandemia del COVID-19, después cuáles son los impactos que esto ha tenido en términos políticos y sociales, para luego pasar a hablar de los retos hacia la educación superior y en particular a la universidad más importante del país, que es la Universidad Nacional Autónoma de México. Y ahora les explico por qué la considero la más importante, no es nada más porque tenga yo el privilegio de trabajar ahí. El primer caso de COVID-19 fue reportado en México el 27 de febrero de este año y nada se movió demasiado. Fue hasta casi mediados del mes de marzo cuando la Secretaría de Educación Pública, que es el órgano federal que regula el funcionamiento de la educación elemental y de la educación secundaria y algunas áreas de la educación superior en México, señaló que se había decidido prolongar las vacaciones de la Semana Santa, que en México es lo que llamamos la Semana Mayor, y luego la semana que viene después del Domingo de Resurrección. ¿Por qué? Para que los niños, los jóvenes no tuvieran necesidad de dialogar, de tener contacto cercano con sus compañeros. En este momento hay ya más de 80,000 contagios. En este momento ya pasamos de los 9,000 muertos. Hay una fuerte controversia alrededor de estas cifras, pero son las cifras oficiales y esto nos coloca en América Latina en el tercer lugar de mayor impacto de esta pandemia. Estamos atrás del Brasil, como ya se escuchó, y atrás del Perú, que ha tenido una política mucho más restrictiva de lo que hemos tenido nosotros. ¿Cuáles han sido las acciones fundamentales por parte del gobierno? Bueno, ya dije que la Secretaría de Educación Pública estableció esta cuarentena. Bueno, primero fue extender las vacaciones y después se ha venido prorrogando la cuarentena y se ha integrado, se ha desarrollado un programa de educación virtual, de educación a distancia. Por otra parte, se estableció una cuarentena, pero es una cuarentena que no está obligada, que no está forzada por ningún medio coercivo. Esto quiere decir que no nos sucede como en el caso de Chile o del Perú, en donde el ejército está encargado de forzar a la gente que se encuentra en las calles y que no tiene un permiso para poder ir al supermercado a comprar sus alimentos o ir a la farmacia, es regresado a su casa y en muchos casos multado. No, en el caso mexicano es bastante abierto, es bastante laxa esta cuarentena. Se insiste, quiero señalar nuevamente, en el guardar distancia, una distancia de 1,5 metros, 2 metros entre cada individuo. Ya en las últimas semanas se ha insistido en el uso de la mascarilla o algún otro medio de protección de la cara, y por supuesto todas estas enseñanzas acerca de que hay que lavarse las manos, mantener la higiene en casa, todo este tipo de cosas. El impacto que hemos tenido ha sido muy, muy fuerte. La nuestra es una sociedad que en este momento está impresionantemente polarizada. El gobierno del presidente López Obrador ha sido un enorme, ha tenido una enorme capacidad para generar polémica. Es uno de los elementos que utilizan para mantener su legitimidad y su presencia dentro de la sociedad. Aquí el tema es que frente a una circunstancia como esta, la oposición se ha venido fortaleciendo, y particularmente la oposición en medios masivos de comunicación y sobre todo en redes sociales. Hay un elemento que ha alimentado de una manera muy importante la oposición al gobierno del presidente López Obrador, que ha sido que aparentemente no hay recursos para prácticamente nada en términos de el accionar público. Han venido recortes muy fuertes en el ámbito de las esferas públicas. Por ejemplo, la educación superior está sufriendo embates sumamente fuertes, y hay que señalar la educación superior pública. El sistema público de educación superior recibe su financiamiento fundamentalmente de los recursos del gobierno federal. Bueno, pues esto ha venido disminuyendo y ha sido unos elementos con los cuales se ha atacado de una manera importante al presidente. Resultado de esto, un presidente que inició su gobierno con cerca del 70% de aprobación entre la población mexicana, en este momento anda alrededor del 31%. Le ha sucedido lo contrario a lo que ha pasado a casi todos los presidentes latinoamericanos que han subido en sus rankings en términos de aceptación de la población. Aún el presidente Piñera de Chile, que empezó la pandemia con un 6% de aprobación, ha subido ya a un 21%. En nuestro caso ha habido un descenso, y esto tiene que ver particularmente con ciertas actitudes, pero sobre todo el manejo de los recursos públicos, que le han pegado de una manera muy fuerte a la educación superior. ¿Qué decir de la educación superior en México y qué retos está enfrentando en este momento? Bueno, ya lo he señalado, está en primer lugar este tema de tener que defender los recursos que recibe para poder seguir desarrollando las tareas. Aún la universidad, decía, más importante del país, es la más antigua, es la mayor, tiene alrededor de 350,000 estudiantes, es la mayor también en términos de personal académico, tiene alrededor de 25,000 profesores de tiempo completo, y hace la mitad de la investigación que se hace en este país, y tiene una cantidad muy importante de distintos programas docentes. Alrededor, bueno, tiene 2 bachilleratos, 2 sistemas de bachillerato universitario, imparte alrededor de 125 carreras, tiene más o menos 75 programas de posgrado, cada uno subdividido además en 3 o 4 niveles de la educación de posgrado. Y bueno, estas son más o menos las cifras. Y esta universidad ha sido, digámoslo así, un pionero, una pionera en México en términos de la educación a distancia. Ya hay alrededor de 40 años en que se han probado distintas maneras de educación a distancia, desde lo que se llamó la educación abierta, que es presencial pero con muy baja carga horaria, hasta la educación en línea y un bachillerato en línea que funciona muy bien, que fue generado específicamente para atender a los mexicanos y las personas de origen mexicano radicando en los Estados Unidos para que puedan terminar su bachillerato. Hay alrededor de 20 licenciaturas que se imparten en línea, y la educación continua también está utilizando mucho como un instrumento de docencia. ¿Cuáles son los retos fundamentales? Ya decía yo, el primero es la necesidad de defender su presupuesto, la necesidad de defender el papel social que ha tenido nuestra universidad a lo largo de nuestra historia. ¿Cuál es el papel fundamental de la educación superior en México? Es el de ser un enorme promotor de la movilidad social. El hecho de que 7 de cada 10 estudiantes que tiene actualmente la universidad sean los primeros jóvenes que dentro de sus familias pueden asistir a estudios superiores, a estudios universitarios, es un buen indicador de esto. Pero ha sido particularmente significativo este reto. Enfrentar las nuevas características que nos impone el COVID, pues nos plantea un reto muy fuerte. Muchos de nuestros estudiantes no tienen Wi-Fi o Internet en sus casas. Muchos de nuestros estudiantes no tienen instrumentos que permitan conectarse a la red para recibir sus clases en línea. Muchos tienen que compartir con 2 o 3 hermanos la única computadora viejita que tienen o utilizan el smartphone que han podido adquirir con sus ahorros. Uno de los grandes retos es cómo vamos a lograr salvar esta característica de una institución que promueve la movilidad social cuando la educación a distancia, la educación virtual nos implica costos sumamente altos que el promedio general de los ingresos de nuestra sociedad no permite tener. Otro reto muy importante tiene que ver con el desarrollo de las capacidades para hacer la educación virtual. ¿Qué quiero decir con esto? Cuando el coronavirus empujó a toda la educación superior hacia la educación virtual, bueno, pues nuestra universidad, por ejemplo, fue muy eficiente en eso. En 2 semanas, nuestro rector informó que se habían abierto 11,000 aulas virtuales para poder impartir educación. El tema es que ni los estudiantes tienen las capacitaciones ni las capacidades prácticas para poder acceder a esto, y por otra parte es meternos en el proceloso mar de las distintas plataformas, de los distintos sistemas para la comunicación, algo que una enorme cantidad de los profesores de la universidad no nos habíamos dado la oportunidad de hacer. Ahora tenemos que luchar frente a eso. Un reto muy importante también es que tenemos que responder a las necesidades prácticas de nuestra sociedad. ¿Y qué quiero decir con esto? Las universidades en América Latina tienen unos retos muy importantes, entre otras, proveer ciertas capacidades, cierta información, cierta formación, pero también responder a necesidades sociales. En el caso mexicano, las universidades han tenido que responder, por ejemplo, de una manera eficiente para que sus estudiantes de medicina en los últimos grados continúen haciendo sus prácticas en los hospitales públicos, pero ahora tienen que ir con protección suficiente para evitar el contagio, por ejemplo. Parte de nuestras instituciones están trabajando en el desarrollo de vacunas o en el desarrollo de mecanismos para identificar a quienes están enfermos. Tenemos que hacer eso, estamos respondiendo, pero son respuestas. Tenemos que hacer de alguna manera, tenemos que incorporar de alguna manera en nuestra práctica el ejercicio de pensar en futuros de mediano y de largo plazo. ¿Qué va a pasar dentro de 30 o de 50 años? Hay quienes sostienen, por ejemplo, que una epidemia, no del coronavirus, pero una epidemia de gripe sumamente fuerte, sumamente importante, podía desatarse en cualquier momento. No estábamos preparados para eso, no habíamos visto con la suficiente antelación para actuar frente a esto. Y el último reto que creo que es muy importante que tenemos que enfrentar es el de mantener un espíritu humanista en la educación que se imparte. un espíritu humanista que no se aprende en las máquinas, un espíritu humanista para el cual todavía no hay recursos suficientes a los cuales acudir en línea. No hay una gran parte de los acervos del conocimiento, de la experiencia humana, todavía no están en línea. Tenemos que acudir a bibliotecas especializadas, tenemos que acudir a archivos, tenemos que dialogar con respecto a cómo lidiamos con ese material. Y la otra parte de esa educación humanista tiene que ver con el trato cotidiano que no se da a través de pantallas LED, a través de pantallas de cristal, que se da en justamente la cotidianidad, en el intercambio de opiniones, en el intercambio de conocimientos, en el esfuerzo por construir lenguajes, visiones, sensaciones, sensibilidades compartidas. Ese es tal vez el reto más importante que enfrentamos las universidades en la actual. Cómo mantener esta beta que nos hace plenamente seres humanos. Y con esto lo dejo. Muchísimas gracias.
Thank you, Professor Ruiz, for such an interesting presentation. This really complements the other two talks that we on the side of education. So thank you. I've been receiving questions for you and for the other panelists. So we'll continue with this discussion later. We'll continue with the fourth presentation by Professor Miguel Rodriguez Mondoñedo. He is a professor of linguistics and Spanish at Pontificia Universidad Católica del Perú. Professor Rodriguez Mondoñedo is the Associate Dean for the College of Humanities. His research examines the syntax of Spanish-Peruvian dialects, as well as the Peruvian Sign Language. He is the principal investigator of a research team writing a grammar and a dictionary of Peruvian Sign Language. His presentation is entitled COVID-19 in Peru, Languages, Culture, and Education. Professor Rodriguez Mondoñedo.
Thank you. Thank you for the invitation. It's an honor to be here. I'm going to share a PowerPoint, if you allow me. So I hope everybody's seeing it.
Sí, podemos verla. We can see it.
Excellent. Sorry. I think I'm going to stay like that because, you know, close my screen. So I hope it's fine like that. Let me start by showing you this little video about our situation in the last weeks. You see, Peru is right here. This is a number of cases. Not only the number of cases, but the number of the increase of the contagious rate. You know, so we are now one of the most, not the most, but one of the most contagious region in the area. I wanted to call this the rise and fall of Peru, but actually a better title would be the fall and rise, because we are rising in the number of cases and the ratio of our contagious. And as we have, as of yesterday, this amount of cases, 140 or more thousand cases already, over 4,000 deaths. Although the lethality is just 2.89, it seems low, but there is a huge range of undercounted people. As you can see, as of today, as of a couple of days, Peru has the highest excess death relative to its historical average for the same date in the world. And you can see here, Peru has a huge amount of excess death. Most of them are not counted as COVID-19 deaths. So that's why the official number that we saw here is very low. The official percentage of lethality is very low. But if we saw the excess death, the historical excess death, well, we have a very, very different situation. We are one of the worst country that relative to its population exhibits a huge amount of excess death. Most of them are not counted as a COVID. Of course, we don't know if they are really COVID, but it's an excess death. So what happened? Because as you have heard in the previous presentation, Peru was one of the countries that reacted very strongly against the COVID. We imposed a severe quarantine. We put the army in the streets. But what happened? Well, what happened is something that is also happening in several other Latin American countries. We have a very informal situation. 70% of the workers work for the informal economy in different sectors. So you can see this line is the totally informal economy per sector, and these blue lines are the independent individuals, people who doesn't have an assigned job. They are just independent. That is also huge. But you can see also, for instance, in construction we have few independents, meaning 23% of only independent. The other are from business, big businesses. But even that, the number of informality is huge, in over 80% or almost 80%. 23% are the independent. The 77 others are the business, which means, given this difference, that many businesses, huge corporation, well, I don't know call it corporation, but there are plenty of business that are also informal, not just individual people, but also huge business. So business with several workers. So when I heard, and I also heard that Peru was in quarantine, I mean, it's just legally they were in some streets. You can see the army there. Sometimes they stop you, but not everywhere. No, there's a picture taken in the very few days before, and as you can see, people is on the streets. Actually, everybody is on the streets. No, not true. Not everybody is on the street. I am not on the street. I'm working at home, but many people is on the street. People is taking the bus. Buses are crowded. We have now the electric train, and it's also crowded. And there are plenty of places where you can find huge crowds of people. Of course, as you can imagine, they are probably the rural poor, and they are, of course, they don't have a job that they can be done from home. No? So let me stress this. Legally, we are under severe quarantine, but in reality, there are huge amounts of the population who is outside. Of course, as I said, they are the urban poor, people with no safety net, but also there is a pressure for the business sector to open the economy. Even if there are multiple reports of COVID infection among workers who have continued working because their sectors have been considered essential, like food, people who work in the food industry or even in mining. True, the government put the army and the police to control, but basically it was unable to actually enforce the quarantine in a proper way. So that's what happened. We have on paper a very severe quarantine, but in the reality we have a very lax one. Now the area has been the area which has been more affected by this pandemic is rural areas, but in particular the Amazonian communities. There we have several dozens actually of indigenous communities. In fact, in total, Peru has 49 languages different from Spanish, 1 sign language, 4 Andean languages, and 45 Amazonian languages. And actually, as you can see here, the impact of putting aside Lima, which is, of course, the highest level of contagion, but we have 1/3 of the population living in Lima. But you have in the Andean zone, there are not really too many cases. There are not really too many cases. But in the Amazonian, we have a lot of cases and a lot of death. That's because in the Amazonian, we have almost no health services. The access is difficult from the urban areas. Flights right now are severely restricted. So government aid is also severely restricted. Actually, even doctors are paying the price there. This region has the highest level of contagion among doctors and among health workers. No? Even the Secretary of Health even say that doctors don't have privilege. So to justify that sick doctors in the Amazonian are not brought to Lima for treatment. Lima, in fact, has 4 doctors per 1,000 inhabitants, which is not that much. But in the Amazonian, there is only 1 doctor per 1,000 of inhabitants. And that's for the rural areas. Because if we go to the indigenous, sorry, that was for the urban areas in the Amazonia, the few cities that are there. But if we go to the indigenous areas, well, we find that actually in some communities there is only 1 doctor for each 11,000 people, and not only that. No, politics also plays a role, unfortunately. Here, the government has mandated a huge economic stimulus and the distribution of many resources, but the system for the distribution is very, very bad. Let me give you an example, which is there in Spanish. The mayor of a town in the Amazonia received government resources to distribute, and he went to several indigenous areas without protection, and he and his team were infected and spread the virus across several populations in the Amazonia, and that was the news there severely. So we have this curious situation where the government is sending help, but actually is sending also the virus, and also for political reasons, of course. In fact, we have already saw several Amazonian languages have few speakers. There are many languages in the Amazonian, 44, but some have very few speakers. For example, Omawa has only 5 speakers. Actually had only 5 speakers, but 2 of them are died already from COVID. Now, with respect to the topic of my presentation was the higher education, the universities. Well, I am a professor at the university. I'm teaching in a private university. I'm there teaching the classes online using Zoom, of course, but not everybody is that lucky. In the cases of private universities, all private universities are online at this moment. But public universities try to, but fail. Not only because there is a huge lack of resources among students and also among instructors, but students don't have even a computer at home. They use the cell phone in the best cases. They have bad or no connection, most of them. Even professors, even instructors don't have enough resources to sustain online classes. So many private universities cannot start classes. They cannot start classes because both professors and students don't have the proper resources. They are, and not only in terms of a computer or a good connection, but also in terms of training. They don't know how to use these resources, and they need training, and people are starting to train, and people are starting to, you know, get acquainted with this system. So probably in the next weeks, we will have more and more online classes at public universities. But what happened to, you know, high school or elementary school? Well, in the case of private schools, also not in every private school, but many private schools are online already. But the huge, most people depends on public education. So what the government has done for that, well, they have put a TV program. So they have hired actors and actresses, and they have, you know, they have a program where they teach several topics, and people have to see it by the TV. So the students have to watch for TV their classes and receive some feedback from their teachers for different you know, ways. Probably sometimes they use WhatsApp, sometimes they use email, and they have limited contact with the students in several ways. That depends also on the particular school. Rural schools are in a very, very bad situation. Urban schools are better, but they only use TV. No? Even this is for kindergarten. We call it inicial, educación inicial. It's for kindergarten. Even for kindergarten, there is a TV, and of course for high school and so on. Well, what can we do? What is the solution? Well, the truth is we have no idea. We have no idea what we are going to do. People here in Peru is becoming very afraid, very afraid. There is a sensation that we're going nowhere. The government actually still has some popularity, but it's decreasing. And the government has managed to put a face, but there are a lot of people who's trying to break that face, trying to, you know, put question on the many ways the government has been trying to organize. People have pointed out also that many programs have failed. The government has mandated economic stimulus that want to put money on the people's accounts, but many of the people who are beneficiary from this money don't have an account. So they don't have an account where the government can put money in. And so they put a public account that people have to go in person to the banks. And so there are huge lines there where, of course, people that people don't maintain any kind of social distance. So banks have become also a point where infection spreads, where the virus spreads. That's a point of infection. So in all honesty, we don't know what we're going to do. We don't know. And there are no really many great ideas about what to do. Of course, people talks about a new social pact. That's a good way. Probably that's what we need, but we don't have any practical plan, any practical proposal to live from this situation. Well, thank you very much, and that's it.
Thank you, Professor Rodriguez Montoñero, for such an interesting presentation. This really gives us a different perspective of the impact of this pandemic and indigenous communities. And I'm sure we're going to have to talk more about this in the discussion. I will conclude this panel with the fifth presentation by Oscar Martinez. Oscar Martinez is an award-winning journalist in El Salvador and co-founder of El Faro. This is an online journal, elfaro.net, elfaro.net. This is the first online newspaper in Latin America providing in-depth coverage of migration, violence and organized crime in Central America. Martinez has received numerous awards, and I'm just going to mention a few. There are several awards that we received, but I'm just going to highlight a few. In 2018, he won Mexico's Fernandez Benitez National Journalism Award. In 2019, he was awarded the Human Rights Prize at the Jose Simeon Cañas Central American University in El Salvador. And he is the author of The Beast, Riding the Rails and Dodging Narcos on the Migrant Trail, for which he was awarded the Walla-Duke Book Award in 2014. The talk of his, of his presentation is Between Hunger and Pandemic, El Salvador, entre el hambre y la pandemia, and this presentation will be delivered in Spanish. So if you wish to hear this in English, please select the language English. Oscar.
César, muchas gracias. Ha sido muy interesante escuchar a todos los panelistas. Les agradezco la invitación y les agradezco que me escuchen. Va a ser inevitable. Vivo en un país donde es inevitable, es imposible silenciarlo. No se extrañen si escuchan ruidos raros, porque así es esto. Empiezo diciéndoles que en El Salvador la situación actual en términos de número no es ni de cerca escandalosa. El Salvador tiene ahora mismo, con una población de 6.5 millones, que luego matizaré, esa población tiene 42 casos de personas fallecidas y 2.278 casos de personas contagiadas con el virus. El Salvador fue uno de los primeros países que tomó medidas drásticas, no en la región centroamericana, sino en el continente. Nosotros estamos en cuarentena obligatoria desde el día 21 de marzo y las fronteras completas del Salvador fueron cerradas desde el día 11 de marzo. Es decir, es imposible, es innegable decir que el gobierno actual actuó con agilidad ante la pandemia. Y sin embargo, la pandemia ha generado una crisis política, una crisis social y una crisis económica sin precedentes en el país. Es decir, no es equiparable lo que nos ha ocurrido aún, porque esto está la curva está en el momento más crítico, no es comparable lo que nos ha ocurrido en términos de salud con el destartalamiento que nos ha ocurrido en todos los demás rubros de nuestra democracia. Voy a llegar a donde hemos aterrizado con la pandemia, pero primero déjenme explicarles algunos retazos de quiénes somos. No me voy a referir a la región, que siempre nos suelen encapsular como Triángulo Norte de Centroamérica, a Honduras, Guatemala y El Salvador, sino que solo a El Salvador, por cuestión del tiempo que tenemos. El Salvador, desde la firma de su acuerdo de paz en 1992, tras una sangrienta guerra civil, es una democracia armada a retazos. Somos un país, y me atrevo a decir una región desigual, es decir, con 6.5, todos los datos que voy a dar son datos que yo pongo en cuarentena, por una razón concreta, aunque la ley orgánica obliga a que se haga un censo poblacional y de vivienda cada 10 años, el último censo se realizó en el año 2007 y el anterior se había realizado en el año de 1992. Yo creo que el presidente salvadoreño tiene razón cuando hace unos días dijo que somos muchas más personas que 6.5 millones de habitantes y 2.8 millones de personas que emigraron y habitan en otro país. Pero bueno, no me queda más que atenerme a las cifras oficiales. Con 6.5 millones de habitantes, actualmente se calcula que tenemos a 2.2 millones de personas en pobreza, lo que significa que viven con menos de $5.5 al día. Esta también es una cifra que tiene otro matiz mayor, es decir, muchos gobiernos han alterado o manipulado el criterio para seleccionar quién es pobre o no. Yo diría, sin temor a equivocarme, que decir que solo 2.2 millones de salvadoreños son pobres es decir poco. Pero bueno, sigo ateniéndome a las cifras oficiales. Esta base de pobreza ha sido sólida desde la construcción de la democracia. Si bien tras la guerra civil en el 92 El Salvador experimentó una reducción importante a través de los años de su base de población pobre, según los criterios oficiales. Esa reducción se detuvo en la última década. Y esa base de 2.2 millones de pobreza es sobre la que se ha construido esta flaca democracia, que tiene en términos económicos además un 2.3% de crecimiento en el Producto Interno Bruto, lo cual es muy precario, y que tiene una deuda de 70.7% del Producto Interno Bruto, al menos en 2018, según organismos internacionales. Se generan, según yo matizo siempre, porque como periodistas nos toca acercarnos a la realidad de cómo elaboran esas cifras cada día, y puedo decir que de una forma muy precaria, muy incierta y muy poco transparente. Se generan 30.000 empleos por año y se necesita el mínimo de 40.000. Es decir, hay un importante déficit. Esta es una población, este es un país donde el 60% de la gente hace trabajo informal. Podría decir mucho sobre el trabajo informal, pero diré algo que yo creo, a ver, sobre lo que he escrito, algunas crónicas, muchos relatos, junto con mis colegas. Yo creo que los define algo, es decir, no tienen prestaciones en primer lugar, y en segundo lugar, si trabajan ese día, cenan, y si no, no. Esa es la definición más exacta, es decir, en el centro de San Salvador, en la meca del trabajo informal de este país, el punto cero de la nación, cerca de 24.000 personas trabajan todos los días en el sector informal, vendiendo lo que pueden, pagando extorsión a las pandillas, etc. Pero bueno, dejo esas pinceladas sobre quiénes somos en términos de desigualdad. Somos, y El Salvador lo es concretamente, una región, y El Salvador es un país migrante. Tenemos, repito, el subregistro de alrededor de 2.8 millones de personas que no habitan dentro del país. Digámoslo claramente, porque estas cifras, hay numerosos estudios que pueden encontrar, aunque sé que mucha de la gente que nos ve ya ha leído, gente que se largó de este país arriesgando sus vidas, mayoritariamente gente que cruzó los 5.000 kilómetros que implica pasar México en un promedio de 28 días, abordando un promedio de 8 trenes como polizones, para intentar llegar a la meca de la migración centroamericana, que es Estados Unidos. Esa gente que se fue de esa manera, aún a día de hoy aporta alrededor del 16% del Producto Interno Bruto de El Salvador. Es decir, son personas que no tienen ninguna asistencia a la hora de irse del país, pero que son muy apetecibles a la hora de convertirse en dinero, en dólares. En el momento en el que los países vuelven a pensar en un migrante, cuando ese migrante se transforma en remesa. Estas son las pinceladas de momento que dejo sobre quiénes somos como región migrante. Es imposible obviar que también somos una región violenta. Podría medir esto con varios delitos, pero me quedaré con el clásico, con el que nos han etiquetado desde hace muchos años. Somos un país, hemos sido, y habitualmente en las últimas 2 décadas, el país con la tasa de homicidios más alta del mundo, el país más homicida del mundo. Y aquí hago un pequeño repaso de cómo nos convertimos en eso. Hay pocos registros de la última década del siglo pasado, y los registros más confiables de números empiezan a existir desde el año 2000. Tuvimos en el año 2002 nuestro año más pacífico en El Salvador, cuando rondábamos la tasa de 36.2 homicidios por cada 100.000 habitantes. Para poner esto en perspectiva, la Organización Mundial de la Salud dice que si algo ocurre a más de 10 por cada 100.000 habitantes, ese país vive una epidemia de ese algo. Nosotros vivimos una poderosa epidemia de homicidios desde hace mucho tiempo, es decir, 36.2 ha sido a día de hoy nuestro mejor registro anual en el siglo. La tasa de Estados Unidos es 5, para poner un ejemplo. Pero tras ese pacífico, entre enormes comillas, año de 2002, un gobierno de derecha, no el primero, un gobierno de derecha, implementó el plan mano dura y convirtió a las pandillas en el centro del debate de la política pública sobre seguridad. Y crearon algo que llamaron un plan mano dura y lanzaron con mucha pompa. Cuando ese gobierno heredó al siguiente gobierno de derecha, ya El Salvador rondaba los 42 homicidios por cada 100.000 habitantes, pero el siguiente gobierno de derecha, en un derroche de creatividad, implementó el plan Super Mano Dura. Cuando ese segundo gobierno de derecha dejó El Salvador en el año 2009, ya éramos el país más homicida del mundo, con 71 homicidios por cada 100.000 habitantes. Y eso continuó con la llegada del gobierno de los gobiernos de izquierda, han sido dos. El Salvador llegó al año 2015 a la impresionante y sangrienta tasa de 103 homicidios por cada 100.000 habitantes, o si quieren verlo en números más sencillos, 1 de cada 972 salvadoreños fue asesinado. La violencia ha sido utilizada como un arma política en este país, e incluso el actual presidente, siendo alcalde de San Salvador, negoció con las estructuras pandilleras para limpiar el camino y poder llegar hasta la presidencia. No puedo dejar de mencionar, aunque seré muy breve para poder terminar, el ingrediente de Estados Unidos. Las pandillas no nacieron aquí, nacieron en Estados Unidos, y cuando Estados Unidos determinó que eran un problema en el sur de California, decidió deportar a cerca de 4.000 miembros, pandilleros, expertos en organizar pandillas, a un país destruido que intentaba reconstruirse después de la guerra. Esas 4.000 personas deportadas a El Salvador ahora mismo son 62.000 miembros activos en el país y 10.000 miembros activos en Estados Unidos. Es decir, la receta que se sigue aplicando es, evidentemente, y ha sido demostrado a lo largo de las décadas, una receta podrida. Pero se sigue aplicando porque se utiliza más como un arma política que como una política de seguridad pública real. Una crisis, dicho a estas pinceladas de la región, debo decir que una crisis es también un momento donde las carencias se acentúan. Repito que El Salvador no tiene números escandalosos de fallecidos hasta el momento, aunque estamos escalando en la curva. Pero veamos qué ha pasado. En términos de desigualdad, el primero que mencionaba, la desigualdad ha brillado. La cuarentena desde el 22 de marzo ha convertido a la pobreza como un obstáculo enorme a los planes poco transparentes de este gobierno. Es decir, hay banderas blancas, no hay números para decirlo. Yo recorro el país todos los días, hay banderas blancas afuera de casi todos los barrios. No hay un censo para determinar cómo hacer la entrega de canastas y de la ayuda de $300 por familia que el gobierno ha intentado entregar. Hay gente desesperada habitando en mesones, que son casas reconvertidas en cuarterías, donde, y ya ha habido casos de contagio en mesones, empiezan a haber estas últimas semanas, donde todos los eslogans de la pandemia, la sana distancia y quedarse en casa, es algo imposible. Lo de quedarse en casa por el hambre y lo de la sana distancia porque 100 personas pueden compartir una única letrina para hacer sus necesidades adentro de un mesón. La infraestructura de desigualdad de este país es una infraestructura en términos económicos y en términos habitacionales inadecuada para cualquier pandemia, así sea una pandemia mucho más leve que la que estamos viviendo. Somos una región migrante, dije, y además una región sometida a los designios de Estados Unidos y de México en muchos casos. Pongo algunos ejemplos. El 11 de marzo se cerraron fronteras en el país, pero para el 8 de abril, es decir, no puede regresar la gente. Cerca de 4.000 salvadoreños, la mayoría de clases económicas acomodadas, quedaron varados fuera del país y siguen varados a día de hoy. Hay algunos que tienen 72 días sin ningún plan para poder regresar y ver a sus hijos, aún aceptando pasar una cuarentena gubernamental. Pero hasta el 8 de abril, que nos dieron cifras, 800 personas deportadas habían llegado de México y de Estados Unidos. Es decir, las fronteras se han cerrado para todo, incluso para el migrante que por su cuenta quiere volver al país tras un intento frustrado de cruzar México, pero no están cerradas para los deportados. Ese es un signo de estos tiempos, que nos habla mucho de quiénes somos y lo poco que podemos hacer para oponer resistencia en esos términos. México se ha convertido y ha aceptado las políticas estadounidenses y ha actuado como un gran centro de cuarentena. En Matamoros hay un centro de deportados donde hay 2.400 personas hacinadas a la orilla del río Bravo, que han sido migrantes centroamericanos en su mayoría, que han pedido asilo del lado estadounidense, pero con este plan Remain in Mexico que lanzó la administración Trump, Ahora quien pide a Estados Unidos asilo debe de esperar en México. Otro signo de estos tiempos, es decir, no quieren, cada segundo cuenta. Cada segundo en que un migrante esté fuera de las fronteras estadounidenses parece ser un segundo de oro para la administración Trump. Y Centroamérica no se ha quedado atrás desde antes de la cuarentena. Es decir, Centroamérica sigue recibiendo deportados. Guatemala reportó un vuelo de deportados donde aseguraban que el 75% iba infectado con el virus. Y la región sur desde antes había decidido sumarse a la lógica estadounidense de que el sur persiguiera al sur. Centroamérica creó el Plan Gobernanza en Guatemala, que es un plan para detener migrantes centroamericanos en Centroamérica, y El Salvador lanzó, obviando toda la simbología de ese nombre, en diciembre del año pasado, su patrulla fronteriza. Una patrulla que patrulla, perdón la redundancia, nuestras fronteras para que nuestros migrantes no puedan salir. En ese contexto paso a la última de las aristas que había mencionado. Somos una región violenta. En este gobierno ha habido una reducción de los homicidios sorprendente. Si el año se sigue comportando como lo ha hecho hasta este mes, terminaremos este año superando el registro del año 2002. Será el año menos homicida de El Salvador. Ha habido una reducción sin transparencia, ni siquiera han presentado cuál es el plan. Y es evidente que parte del elemento de la reducción de homicidios es que las pandillas hayan decidido dejar de matar. Las estructuras están intactas y hay una prueba que esta pandemia nos deja. El 2 de abril, la Mara Salvatrucha, la mayor estructura criminal del país, subió videos sumándose al esfuerzo del gobierno de exigirle que a la gente que se quedara en sus casas. Subieron videos golpeando con bates de béisbol a vecinos que habían violado la cuarentena y que eran castigados de esa manera. De alguna manera, según nuestra fuente dentro de la pandilla, ellos se sintieron marginados tras haber hecho algo que suponían era defender las políticas del Estado. A partir de ahí, la pandilla decidió entre el 24 y el 27 de abril aumentar los homicidios. Y un país como El Salvador, que traía durante la gestión de este gobierno un promedio de alrededor de 2 homicidios diarios, tuvo durante esos 4 días de abril 19 asesinatos diarios. Es decir, la pandilla en pandemia ha demostrado que si quieren volver a matar, vuelven a matar. Es decir, que no había planes estructurales para solucionar el problema de las pandillas. Y los asesinados, como siempre, porque esto es un círculo perfecto, son niños, asesinaron a una niña de 12 años, ancianos, pobres, campesinos en su mayoría, obreros, es decir, los que tienen hambre, los que migran, los que viven en esos mesones que describí. 76 personas fueron asesinadas en este minúsculo país en 4 días, cuando la pandilla no se sintió escuchada. Somos una democracia débil, que por la historia que tiene busca caudillos y prefiere responder a mensajes emotivos. Dios, el pueblo, las emociones. Y eso ha llevado a que durante esta pandemia la democracia se debilite más. El presidente Nayib Bukele, el más joven presidente que hemos tenido, 39 años, es un presidente que ha decidido gobernar solo y convertir a la oposición política en enemigos y en agentes de la muerte, y también a los periodistas que hacemos periodismo crítico. Ha decidido durante esta cuarentena desoír a la Sala de lo Constitucional, acusarla de intentar asesinar salvadoreños con sus disposiciones, ha acusado a la Asamblea Legislativa de lo mismo y ha desoído a ambas, aunque las organizaciones internacionales más importantes le han explicado que eso es una flagrante violación del orden constitucional. Entonces, El Salvador parece que va a salir de esta pandemia, aún no sabemos con cuántos muertos, pero sí tenemos claro que con una democracia más debilitada y con algunas lecciones que ya sabíamos, pero que se han confirmado durante esta pandemia, lecciones en el desprecio a los migrantes, lecciones en el alcance de la desigualdad, lecciones en la ineficacia del combate a las principales estructuras delictivas del país. Creo que ya me pasé algunos minutos. Así que les agradezco su atención. Gracias.
Gracias, Oscar, for really such an interesting talk. I mean, all these facts are just fascinating, and I'm sure we will be able to make connections between your talk and the other presentations. Well, I have received several questions, and if the participants in the audience, if you have more questions, please send them through the chat or the Q&A function, and I will send them to our participants, to our panelists. But I would like to open the discussion with, if we can all activate the video feature so that everybody can see us. Again, thank you for your wonderful presentations. I would like to open the discussion with a general question for everyone. This is a question that was sent 2 or 3 times. In what ways have the governments and universities responded to the pandemic in your country? So specifically, ¿de qué manera han respondido los gobiernos y las universidades a la pandemia en su país? This seems to be such a broad question, but if you can elaborate a little bit with something specific from your country. Andrea, if you can unmute. Yes.
Yes. Okay. So thank you again. Very good to listen my colleagues, the colleagues here, the presentation. So I think there's several similarities in terms of how government has responding. So different from, I think, other presidents, our president has been really kind of denying or defying the policies in place. That most of the policy in place is quarantine and not very well, how to say, there's no police really implementing implementing the quarantine or social distance. Schools were closed in many places, no essential commerce or business also were closed. But again, this varies from place to place and also has been very, even municipalities has different policies in place. So there is, in this sense, there's a lack of a federal government or a policy in place. In relationship to, there is also, federal government has given 600 reais, which is about maybe $125 for individuals who cannot work during this time. There is some possibility this is going to be like they are able to receive 2 more payments, up to 3 months of payment of this extra payment, especially for those being affected by informal economy, those who work within informal economy. It seems that they use, how to say, cadastro of the Bolsa Familia with this cash transfer cash program that has been used to really reach some families or to get this money, monthly money. But again, it's only once right now, and maybe a possibility to become like three getting 2 other more. But as our colleagues, I think in Peru, is also addressing issues. There are many people who are not in the system. So how to get them, how to reach them, because most of them are getting through banks. When you don't have banks nearby, how you get your name in the system, this is a huge issue. So I don't know if I answer your questions, the issues of what a government is doing. I think I didn't address this issue of education. Education also, a lot of schools, private schools are going online. Similar to the United States as well, but also when you put it this, but public institutions, this is fundamental, or even university, they are not, the university had completely stopped. There's no class right now going on. Most of federal institution or university, due to the lack of, computers or access to internet. So it's really, I think these issues of the distance education, online classes and distance education also address issues of inequities in society. I think this is here in the United States, we also have these, but in Brazil, these things you see like, you know, private or individuals or schools working on these and public schools closed. I don't know if I answer your questions because this is like the, and there's these initiatives, you know, like local initiatives in terms of mutual aids. There is a lot of charity work going on in different cities and towns around in Brazil. But there's not a central, you know, this lack of sense of how do you get out of this, I think is, goes, you know, is part of the Brazilian society at this moment as well.
Thank you.
Okay.
Any other panelists? Yes, Miguel?
Well, yes, I wanted to comment on that too. Here on paper, the government has behaved very well. I mean, you see the measure they have taken. They have, you know, imposed quarantine. They have provided for resources to be distributed among people who is not working. But we have a very weak state. Our institutions are very weak, very, very weak, not only in political terms, but also in management terms. So the government has a very, very bad management team. And not only because of particular party or not, but it's just the officials in the government are not used to work in a very effective manner. And we have known that for years, but now we are feeling it in our, you know, in our schools, in our communities. We are feeling very, very strongly, and people is of course talking about this. Some people blame the government because they're mainly on the opposition, but most people realize that this is not just the government problem. No, it's actually for many, many years we have had a very bad health system. We have a very bad government institutions that are not able to distribute even the money we have. We had until before the pandemic a very strong economy, and now we are in the verge of a economic collapse. If things are not solved very quickly, and we will have a huge economic problem too, which still don't have, because we have a lot of savings, we have a lot of international reserve. We are, you know, spending all of that, and we have a great international credit. So we are also using external resources, but that cannot you know, you cannot wait forever. No, you're going to use it forever.
Well, you have an interesting, Ambassador Cáceres, that you mentioned that Paraguay is the second country in South America with the lowest number of infections so far, less than 1,000 cases. Can you share your perspective as to why this is the case? Is the government implementing successful measures to prevent the spread?
Yes, Cesar Felix, I think that it's been the measures that we have taken, in the sense that the country really shut down. You would go outside, you could go to jail, you could be charged. People took it very seriously, and would go on and even announce on social media if there were a party or there were meetings, and it was not easy. We back there, we share a lot of our customs. We share, for example, our mate or tereré, which is a cold mate. If you reject that, you are offending someone. It goes around sharing with people. Paraguay is a very open and very friendly. So there was a big change in attitude, and everything was closed. There was nowhere to go. Schools were closed. Universities were closed. Movies, theaters, restaurants. Basically, you were locked down in your house, and it was complied. There was a high price paid on the economic side, just like in any other countries. You see that here in the United States as well. But awareness and something else happened. I gave some numbers. We had about 900 right now. Of those, about 600 came from abroad, people that came from Brazil mainly. And so there was a big backlash against people coming from abroad. If you go to Paraguay, you got to quarantine. Before there were shelters. Now you could go to a hotel as well, but there's a police there. You can go out of your room, and the measures were extreme, but it paid off. And like I said, it paid off because we have a very weak health system, and that is acknowledged by the government itself. That's why the measures taken were so strong and drastic and draconian, if you could say. We only have, as we speak, we have 9 people in hospitals for this for COVID-19. Like I said, we had 11 people who died. I just had the numbers here. We have about 0.0000135 death of a million people, and we want to keep it that way. And the big challenge is when we open the economy, what's going to happen? I mean, so many things about this situation is unknown. You hear so many theories, and depends who you listen to. It's completely different from the other person, and both of them are experts. Or scientists or doctors. And it's not easy. I mean, now the health minister might be the most popular politician in Paraguay. He goes out daily on a daily basis and gives his report. People are waiting how many, and on average, it's about 3-4 infected persons per day. There are some days in which 0 infection in Paraguay. So people take this very seriously. And I think that's one of the reasons, but we are concerned for our neighbors, and because this will spread, and it's a matter of time. So we see what happens. We try to keep our numbers low, open the economy, and wait for the vaccine, which we are all waiting and praying for.
Thank you. Yes, something is being done right. I was reading an article this morning about Paraguay, and the number of cases are very, very low. So there has been consistency, which is great news. And there's another question that we can connect from the audience to Ruben, if I may. It's about the future for the UNAM. So what are the plans to reopen in the fall, and what's the expectation in terms of the COVID resurgence in the fall? So básicamente, ¿cuáles son los planes para abrir la UNAM en el otoño? Y en caso de que haya otro contagio, ¿cuáles son las medidas que se están tomando? And you can answer in English or in Spanish, and Elisa, you can translate if you will.
Let me try it in English, please.
Go ahead, please do.
Let me try it. Well, it's a big concern in UNAM, this problem that when will we be opened?
Right.
We must consider it's a very, very large university. And it comprises several different systems within it. So we have the teaching system, we have the research system, we have the administrative system, and we have a huge, very strong labor union. So we have to, well, try to deal with all of these different interests, different tasks they have to deal with, and how can we make something that will be working. At the moment, there is no set date for a reopening of the university. Nowadays, the whole of the university is closed. We are working at home, and well, several different tasks have been carried on, but from the home office. And very, very, very few people have to be present in the campus or the different premises of the university. It is thought that maybe in the 3rd or the 4th week of June, these people will be working again inside within the campus and the university premises. Nevertheless, the teaching system is supposed to open up at the end of September. The 21st of September will begin the next term for us. We have only 2 terms during the year. So let's say the fall term will reopen in 21st September. We hope we can do it. Meanwhile, we are trying to, well, give some training to the teachers, to the researchers on the use of the different platforms of video conferences and video teaching and all that it comprises. So that's what I could tell you about this.
Wonderful. And it's true also for Indiana University. We don't know what we'd expect in the fall. We are going to reopen, but in terms of what would happen if there's another outbreak, we still don't have answers to that. So I share your response. This leads me to the next question that I got from the audience for you, Oscar, if I may. And you gave us such a really interesting presentation and facts about El Salvador. But if you don't mind me expanding your questions or to other regions in Central America. You are the co-founder of El Faro newspaper. And I was just reading an article this morning where you guys have included information not only from El Salvador, but from different countries in Central America. So what are some measures that have been implemented in some regions of Central America, not only in El Salvador?
Bueno, mira, lo que nosotros hemos podido estar monitoreando, Guatemala ha tomado medidas similares a las de El Salvador, es decir, ha habido un cierre total de la circulación, hay medidas para quien incumpla la cuarentena, hay un orden para salir a las calles. Y tenés en el polo opuesto, tenés en medio siempre a Honduras, que es quizás el país menos transparente de la región, y eso ya es mucho decir. Eso ya es mucho decir. Y luego tenés a Nicaragua, que es un país que ahora mismo está en una crisis, que los periodistas que hacen trabajo en Nicaragua están tratando con su investigación en el terreno de diagnosticar. Las cifras oficiales son ínfimas. El gobierno negó el coronavirus durante más tiempo incluso de lo que lo hizo Jair Bolsonaro en Brasil, y permitió reuniones masivas. Incluso a mediados del mes pasado convocó a una marcha contra el coronavirus. Es decir, una marcha de esperanza y fe, que son todos los rubros que el gobierno del represor Daniel Ortega ocupa, que es la fe, el pueblo y la concentración de poder. Convocó a esta marcha. Entonces, Nicaragua es muy difícil de diagnosticar, es muy preocupante lo que está ocurriendo en Nicaragua. Quiero volver a algo de lo que preguntabas acerca de lo que está ocurriendo en los países y las universidades, porque está conectado. En El Salvador, el gobierno ha actuado rápido, ha hecho más de 80,000 pruebas en un país minúsculo de 6.5 millones de habitantes. Sin embargo, ha convertido en esto en una crisis democrática que supongo ustedes ya habrán leído en medios internacionales, desde el New York Times, que publicó un editorial, como el Washington Post también lo hizo, sobre la situación en El Salvador. Es muy raro que El Salvador trascienda a medios internacionales. Para que nosotros lleguemos a portada de una de las grandes cabeceras, tiene que haber aquí una guerra o un terremoto o algo similar. Eso pasa con el resto de países de la región. Y en este caso se ha considerado muy importante porque hubo un precedente. El presidente Nayib Bukele, en febrero de este año, antes de la crisis, se tomó la asamblea porque no le aprobaban la negociación de un préstamo con la velocidad que él quería. Tras tomarse la asamblea con militares, entró y dijo que iba a rezar. Y por suerte, durante sus rezos, Dios le dijo que tuviera paciencia. Y esa fue la razón por la que no disolvió el Parlamento. Entonces, en la pandemia, esa actitud se ha agravado. Bukele es un presidente que a día de hoy tiene la aprobación del 93% de la población salvadoreña. Es adorado por la gente en gran medida por lo que los gobiernos anteriores hicieron. Dejaron al país en ruinas. Pongo en términos de salud un ejemplo. Dejaron una cama por cada 100,000 habitantes, una cama de atención hospitalaria para gente que esté grave, de camas UCI. El promedio debería de rondar los 10 y de un país sano debería de rondar los 15. Pero Bukele ha convertido esta crisis en una crisis democrática por una postura muy sencilla. Aplaudan o no estorben. Esa parece ser su lógica. Es decir, yo voy a manejar esto con la ley que me permite no presentarle ninguna probidad a la población, no entregar cuentas a nadie, y a quien critique eso lo convierte rápidamente en un enemigo de una forma muy eficiente gracias a su popularidad. Es decir, el gobierno salvadoreño cree que la democracia estorba a la hora de gestionar esta crisis. Y ese es un mensaje muy claro. Y cierro con esto, con las universidades. La Universidad José Simeón Cañas, UCA, la universidad reconocida por ser la casa de los jesuitas asesinados en 1989, del padre Ignacio Yacuría, uno de los grandes tanques de pensamiento centroamericanos, fue llamada a un consejo para controlar el uso de los fondos durante la pandemia. Hace 2 semanas renunciaron porque dijeron no nos entregan ningún dato, toman decisiones sin consultárnoslas. Somos un consejo técnico al que nadie escucha y al que nadie le pregunta nada, y no estamos dispuestos a ser títeres en esto. Se salieron. A día de hoy el gobierno los ha convertido en un enemigo del pueblo. Los ha convertido en una universidad, casi que literalmente dicho, que quiere que los salvadoreños mueran en las calles, como una y otra vez el presidente repite, ocurrió en Ecuador.
Thank you. And there's another question related to what you're saying, but I'll come back later to that. I have another question there was Professor Siqueira, but also for other participants as well. And this has to do with the prisons in Brazil and the pandemic. Basically, how are prisons doing and what challenges are they facing? In particular, this person is interested in juvenile correctional facilities and how they are dealing with the pandemic. So again, this is a question for Professor Siqueiras and the other panelists.
Ooh, this is a large, it's a big question too.
Yes.
So I do, crisis as many other places in Latin America, our prisons are very overcrowded. This is an issue. They are also, there's a lot of gangs and groups that dominate our prisons, like they are federal and state prisons. So the case, how can I say, I don't know exactly how things are, only what is in the media right now. There are groups in society calling attention to the conditions that they have, sub-conditions, normal conditions before the crisis and now. So what they are trying to distribute, some of the prisons that are more cases, kind of to put them apart. But I don't think, my understanding, and here can be wrong, and there is not kind of a plan going on right now. Like those overcrowded prisons, there are cases, but they are controlling case by case, just putting the prisoners in hospitals or returning them. But there was a call to release some of them that were not so, dangerous. But as far as I know, and I can be wrong right now, these plans didn't go ahead. So they are, my understanding that they are dealing with issue case by case, how the outbreak in different prisons.
Yeah, this is something that we really don't think about. I mean, we're just focusing on social distancing, people outside, but also what happens with people in prison.
Mm-hmm. May I, say one, another issue that, I didn't address here, there's a lot of discussion, more public discussion in terms also of homeless population. How do you deal with the spread of corona, or how do you treat them? And especially in large cities like Sao Paulo, and here talking about Sao Paulo, and of course homeless, there's many places around in Brazil, but how to do with, how to make sure you address homeless population. And my understanding too depends on where you're talking about, cities, and there is a lot of mutual aid organizations trying to address, but there's my understanding, again, I can be wrong here, there's not kind of a plan that's how we are going to do everywhere, or those are the allocation of resources to this group. So, yeah.
If I can add another question that is related from the audience to you, now that we're talking about this. Mazinha Vieira asks if you could talk about the racial health inequality in Brazil, and if there are studies about that.
Yes, there are, and I think I tried to mention this a little bit in my presentation. So there are more, well, I think there is 3 times more what I call blacks and browns in Brazil are dying due in all age groups. It's not older, and even if you take in consideration levels of education as well. So there is 2 or 3 more times African Americans or Afro-Brazilians and what I call blacks and browns dying of coronavirus than white population. You know, the other thing, the other dimension that I talked here a little bit was like the urban poor too. Most of them are, you know, black or brown. So, and there was a report actually that was released yesterday by the University of PUC, I don't know, PUC Campinas, if I'm not wrong, and here is Pontifícia Universidade Católica as well, trying to address this issue of you know, bringing racial data, you know, trying to interpret understanding what is the racial disparities in this crisis, health crisis.
Oh, thank you. Thank you. There's another question related. This is addressed for Ambassador Cáceres. And this is another topic that I would like to continue now, is indigenous communities. So this question for you, Ambassador Cáceres, is, does COVID surveillance include Guarani indigenous populations? And how does the public health system account for those who are in mostly rural communities?
Thank you. Just before I go that, if I can comment, just one thing, what the professor said. I served in Brazil 5 years, and sometimes when we live in the United States, we sort of tend to adapt how people are classified here. I mean, yes, there are a lot of Afro-Brazilians, in large part of the population, almost half it is. But in Latin America, we don't classify ourselves as brown. I mean, we are brown only here in the United States. We lose our color. We are white, but we are not white. We are brown. So it calls my attention that one could refer to brown Brazilians, but maybe they are mulattoes or a mixture. But I just want to later a little clarification on that one, because and in Latin America, you're not asked about your race either when you file whatever paper you do, and so it's very difficult to classify people by your color. Regarding to indigenous population, Paraguay is a country of 7 million people, and we have 120,000 indigenous population. It's 1.7% of Paraguay is indigenous. Yes, they are very vulnerable. They are most of them below poverty level, and there's some migration to the cities. In the rural part of Paraguay, we don't have the virus, fortunately. So there are no cases in rural Paraguay, which it's about 45% of population right now. There are no cases, and when this happens, people would go to where the public hospitals are. But as far as we know, there are no cases reported. And just one more thing about indigenous population that people doesn't know. Paraguay is the only bilingual country in the Americas. 90% of us speak Guarani, and we are very proud of it. That is what gives us our heritage and our pride. And I just wanted to share that with you. I mean, if you go to the countryside in Paraguay and you don't have Guarani, it's very difficult for you to make it. We have about 500,000 people from Brazil living in the rural Paraguay, very successful farmers. And first they learn Guarani. They speak Guarani and Portuguese. They don't speak Spanish, actually. They speak Guarani and they speak Portuguese. I just want to share that with you.
Thank you. Yeah, it is true that it's the only the official country that is bilingual with both Spanish and Guarani. Now, continuing with this topic of indigenous communities, this is a question for Professor Miguel Rodriguez Mondoñero. It was interesting in your presentation that you mentioned that there was one doctor for 11,000 people.
In one particular community, yes.
Right.
In one particular community.
So how does the government or that particular community mitigate the effects of the pandemic, or what's being done?
In fact, the government doesn't mitigate the effect of the pandemic. The rural communities in the Amazonia, with all our indigenous population, are unprotected at all. Several of them are organized and they have closed their territory, so nobody can go out or in. But that's an initiative from the proper communities, from the communities, not from the government. There is no presence of the state in that community, not even in regular times, now even less. With the people who is, however, the virus has spread in some communities. And in that case, people is just dying. There are several private initiatives that want to send, medicines and food and other resources to this communities, but they are all private initiatives. The government is not doing anything about that. It's not doing anything. They have sent medical staff to the cities. In Amazonia, there are several cities. Even there, there are severe problems. There are very, very tough problems there with respect to COVID. But with respect to indigenous communities, the government has put together a plan, I think, in the last 2 weeks, just 2 weeks, meaning after 2 months of quarantine, the government just thought for the first time in this issue a couple of weeks ago. They have a plan on paper, but they haven't executed it yet. They plan to basically the same. They plan to send medical staff, health workers. They plan to send resources, food, but they haven't done that yet. And one of the main issues there is that access is very difficult, right, to this community. You have to go to each community by river, and you use for a day, maybe even more, to get from one community to the other. So there are no other kind of ways to send help or other. If you are not in the cities, which are some of them, then you are really completely at your own risk. And for that reason, communities are taking the business with them, and they are closing their territories. So they are sometimes even armed, and they don't let you in, or they don't let anybody out. No? So in a word, the government is doing almost nothing. No?
Right. I wonder what the situation is like, Ruben, in the Mexican context. Given the fact that we have indigenous communities in central Mexico with the Nahuatl-speaking communities, and then in the south, Veracruz area, where we have heavy populations of indigenous communities. What is the government doing? What's going on there?
Well, first of all, we must admit that Mexico does not accept that here exists racism. We have in our constitution that we are a multicultural society and that we are all equal before the law. That's something we must have in mind, because there is no such thing as an interesting or a particular care in pointing out what's going on with indigenous populations. Nevertheless, the Health Bureau has allowed has given some statistics that say that nearly 900 of the people who have been treated because they have been affected with coronavirus are from indigenous peoples. And that somewhere around 150 and 160 of these people have died. that's a very, very, very high lethality measure for them. The ratio of the general people in Mexico is somewhere around 10% of the lethality. For the indigenous people, it is 17%. This is due to several different aspects, mainly because they are marginalized population. They have not enough health services, and there is also the survival of ancient practices about health. So there are different combinations of factors that deal with this.
Absolutely, and a very different context from Peru, clearly. Now let me move on to another topic. It has to do with politics and crime. And this is a question for you, Oscar. It has to do with how do we understand, in the case of El Salvador, the gangs, that they basically taken over the state. So there's a question by one of the participants in the audience that has to do with, this is related to one of the topics in your book. So what do you think about the notion of the double state? Or there is a lack of a state, of a unique state during these times of the pandemic. So I'm going to read the question in Spanish. It has to do with the President Bukele. Bukele se presenta como un presidente que se ha liberado de los partidos tradicionales junto con sus conexiones con la criminalidad. En tu libro reciente se afirma que en ciertos sectores del país las pandillas se han convertido en Estado. So the gangs are basically controlling the state. ¿Cómo ves este fenómeno de un doble Estado, o si prefieres de la falta de un Estado único en los tiempos de pandemia?
Mira, no tengo ninguna duda de que El Salvador durante mucho tiempo ha tenido un doble Estado en cuestiones muy prácticas. No es que el Estado formal no pueda ingresar a esas comunidades. Las pandillas no tienen la estructura tan sólida financiera de un cártel, pero dominan completamente los lugares donde existen. Es decir, cuando la policía entra y se va, ellos deciden quién puede entrar, a qué horas puede entrar, a qué horas deben apagarse las luces, por dónde pueden circular. El Salvador tiene una demarcación interna que no responde a la demarcación oficial. Un salvadoreño que vive en una colonia de la pandilla Barrio 18 no puede transitar por las zonas de la pandilla Mara Salvatrucha. Es decir, hay salvadoreños, muchos salvadoreños, que no viven en un país, sino que viven en pedazos de un país. Y tienen que saberlo de memoria, porque en esa demarcación se juegan la vida. En esta pandemia ha habido dos hechos claros que nos han demostrado eso. En primer lugar, el que ya mencioné, cuando la pandilla quiso poner sobre la mesa su activo político, que son los cadáveres, pusieron una tasa astral para este momento, una tasa que no triplicaba ni quintuplicaba, sino que mucho elevaba a una potencia muy diferente los muertos que teníamos. Durante esos 4 días que quisieron hacerse notar, mataron a 19 salvadoreños en promedio cada día. Aparte de eso, muchas de las entregas de alimento realizadas por el Estado o por personas particulares que han querido entregar alimentos en comunidades han sido coordinadas por la pandilla. Es decir, es la pandilla quien recibe los alimentos, ordena a la gente y decide qué casas van a recibir esa canasta y qué casas no. Y dejo un hecho más para ejemplificar cómo hay un doble Estado. Todos los partidos políticos del país, absolutamente todos, incluido el partido con el que el actual presidente llegó a la presidencia, aunque no es su partido, tuvieron que negociar con las pandillas para poder hacer campaña política en las zonas que las pandillas controlan. Sí hay un doble Estado en la vida de muchas personas en El Salvador.
Thank you. And there's another related question too, so I'm going to stay with you for a little bit. It has to do with the reduction of homicides in El Salvador. And the question is basically if this situation is similar to what happened in 2012 and 2013. And I'm going to read the question in Spanish. Esta reducción de homicidios que usted menciona provocada por un cese del fuego de las pandillas, ¿es parecida o no a la tregua del 2012 o 13?
No puedo contestar esa pregunta con absoluta certeza. Es decir, yo fui una de los periodistas que en el año 2012, en marzo, firmé el artículo, gobierno negoció con pandillas reducción de homicidios. Lo demostramos y es un caso que ya llegó a juicio. El gobierno de izquierda intercambió con las pandillas beneficios carcelarios por menos muerte. Hemos publicado que Nayib Bukele, siendo alcalde, o su administración negoció con las pandillas. Hemos publicado que esta reducción de homicidios debe de responder a la voluntad de las pandillas de matar menos, y este breve periodo que abrieron en la crisis lo demuestra, pero aún no hemos sido capaces de identificar si hay un pacto y cuáles son los intercambios que el Estado da por ese pacto. Ahora, debo decir que esa es una de nuestras líneas actuales de trabajo.
Thank you. There are actually two more questions for you, but I'm going to stop here. If we have time, we'll come back to you. But this is a question for all the panelists. The question is, and this is an interesting question in terms of cooperation. Is there cooperation among countries in Central and South America with respect to sharing medical expertise, resources, etc., including Mexico, Ruben? Because right now we're looking at the countries, basically we are working to mitigate the spread in our own regions. So the question has to do if there is support among countries in Central and South America to share medical expertise and resources.
En el caso de México, no tengo información. El gobierno actual fue muy enfático desde su inicio de que quería hacer una política de acercamiento particularmente al Triángulo Norte. Canalizaron recursos, canalizaron algunos de los programas que se llevan a cabo en este país con la idea de mejorar, esa era la idea, condiciones socioeconómicas para detener procesos migratorios. Esa fue la idea, pero sobre eso ya no hemos tenido mayor información. Ha sido un programa importante durante el primer año del gobierno del actual presidente. En términos de colaboración en la región para combatir la pandemia, no tengo yo información al respecto. Al contrario, se contrataron algunos médicos cubanos para ir a ciertas zonas de la región. Es lo que hay.
Yeah, thank you. I'm wondering if there's some kind of support between Brazil and the other regions in like Peru and Paraguay.
Actually, in Peru,
Okay, Miguel, yes.
You're asking, okay. Actually, in Peru, we do have a lot of collaboration with other countries in the region, and particularly in Chile, but also in Brazil. Although this cooperation is, as far as I know, between research centers in the universities. For instance, my university, people is working on trying to build a respirator, COVID respirator, a new COVID respirator, and they are collaborating with several countries, several other universities in the country. The government is open to collaboration. We have, maybe you all know, we have a huge Venezuelan population in the country, almost 1 million people here, and a lot of them, many of them are professionals, even doctors. No? And they weren't allowed to work as doctors here before the pandemic, but now they are. Now they are. They have been, well, they have some procedures to do that, but many has been hired because we have a short of personal staff. With respect to, there are also offers from Cuba. The government, unfortunately, especially the Congress, there's a discussion about if we must or not accept Cuban doctors. We haven't reached a conclusion yet, but for the people who is already here, for Venezuelan doctors who are here, they have hired already almost in mass when they have the proper qualification.
Ambassador Cáceres, given your international experience in Paraguay, Brazil, Peru, Mexico, can you share your thoughts on this question?
I know that Mercosur, there are talks, there have been meetings of presidents. I mean, like we are meeting right now, they Zoom as well. And they have come up with a fund of about $16 million to work together and have a common approach. That's the Southern Cone. I don't know what, I'm not aware with Central America or Mexico. I don't think so. But at our level down there, yes, there are talks, there are coordination. I'm sure Chile is part of that, Bolivia as well. So we are working down there, try to have common positions. And of course, we need to work. That's the approach. They don't stop at the border, and there's no other way. Like many other things, is working together with other countries. That's the approach we are to do.
Thank you. Yes. Anyone else? I have another question for.
And one other thing, if I can add, about Cuban doctors, we don't have them in Paraguay, so we don't have agreements with Cuba in that sense.
Thank you. I think maybe we have time. We have many other questions, but I think we have time for at least two questions. One, and just to give opportunity to other panelists. For Professor Siqueira, there's a question that has to do with the initiative and special funds for women. So basically, can you talk about the initiative for women in Brazil during this pandemic? Is the funding available for women from urban, poor, rural, indigenous populations or the favelas?
Okay, just a minute here. So this is, I think, is an interesting question in terms, because there are several studies showing that, if in terms of vulnerability, poor, especially urban women are really kind of in a more vulnerable situation, like poor, because there's in two levels. One, if they are in the household, they are the ones taking care of individuals or their families, or they tend to have a low job, paid job as well, being exposed to, transportation, to contamination. But also there is issues of, issues of domestic violence, which has increased. It's not just in Brazil, numbers, I don't have the numbers right here in front of me right now, but the domestic violence, we have a program that addresses specific domestic violence against women, Delegacia das Mulheres in Brazil. So there are numbers of domestic violence increasing everywhere in Brazil. Then there is another level of women in terms of gender disparity in this sense, because 70% of low-paid people working in the hospitals or healthcare systems are women as well. Like the doctors are, there is a high number of women working as doctors or physiotherapists or other, university college level positions. But most of, what you call assistant nurses, the ones that cleaners, there are also women, and there have been exposed to or being sick during this pandemic. Why I'm addressing these issues in terms of gender, and there is not enough covered or study for the whole country, but especially in the larger cities, that is the situation. And there are specific programs, but as far as I know, and I can be wrong here, there are all kind of NGOs or private initiatives to address women's concern, or more issues of their own health, or trying to address if you are sick, which kind of a compensation. There's kind of a discussion going on in these terms as well, in terms of if you're even working as an assistant nurse, how which kind of a compensation should have. Absolutely. So yeah, I do. If you allow me to say something like, and then. Is a little bit kind of a reply to the ambassador. The issue of race in Brazil is like in Latin America, of course, is very different from here. But in the last 20 years, we also have this in Brazil, we have this myth of racial democracy. But this really has changed in the last 20 years, especially with new affirmative action with the PT, in the last administration, government policy specifically for specific parts of a population. So I would disagree with you. People are really saying that they are Black or brown. There are huge movements, social movements. It's really to how do you say, embrace their ethnicity and their race. And this is a movement that is not just in urban areas. You can go, Black movements in Brazil is very strong in rural areas of Brazil as well. So yes, we are brown population everywhere, but in our census, you know, like when you say it's up to us to decide which color we want to be, and of course, color in Brazil also has to do with your socioeconomic status, right? You know, like this, there's things are connected. But there is a lot of social movements or groups of individuals identify themselves as Black, brown, and a lot of people really also reclaim it as indigenous identity. So this is a movement that is going, a huge movement in Brazil that is taking place at least in the last 20 years. So the sense that we are all equal, like brown and a social democracy, in Brazil at least, this is not in place anymore.
You just answered my next question, which was exactly the notion of race. If anyone wants to comment, please do.
Yeah.
If not, I have no one from the audience. Okay, I have one more question, and then we can go to final comments or thoughts. But this is a question for Oscar, and this has to do with the President Bukele and the notion of authoritarian president. And I'm going to ask this question in Spanish. ¿Cómo evalúa el autoritarismo? ¿Cómo se evalúa el autoritarismo de Bukele? Y si busca únicamente refortalecer su propio poder o si tiene otra agenda política. And basically, his level of popularity. Why?
Mira, el nivel de popularidad de Bukele, yo creo que viene dado estrictamente por dos cosas, por dos factores. El primer factor, Nayib Bukele es un político que sabe hablar diferente y comunicarse de forma diferente, desde la cuestión gestual, vestimenta, hasta el uso de redes sociales o su presencia en un panel televisivo. Es alguien que habla de una manera muy distinta, aunque no deja de ser uno de los mayores demagogos que este país ha tenido. Pero en segundo lugar, el segundo factor, aún más importante que ese, desde la firma de los acuerdos de paz en 1992, El Salvador ha tenido en la presidencia un bipartidismo. La derecha, Arena, el partido fundado por Roberto Dabuizón, el asesino de Monseñor Romero y el fundador de los Escuadrones de la Muerte, y la exguerrilla, el FMLN, quien gobernó desde 2009 hasta la entrada de Bukele en el año pasado. Esos dos países, podría extenderme en esto, pero esos dos partidos destruyeron este país, lo saquearon. Y voy a poner un ejemplo concreto. El tercer presidente de derecha, Francisco Flores, murió durante un juicio en el que estaba acusado de haberse robado las donaciones que Taiwán hizo a El Salvador para mitigar los daños de los terremotos sufridos en el año 2003. Él muere durante el juicio, en el año 2001. El siguiente presidente de la derecha, Antonio Saca, está preso tras haber admitido robarse 301 millones de dólares del erario público. Cumple una condena. El primer presidente de la izquierda, que fue el siguiente después de Antonio Saca, huyó del país a la Nicaragua de Daniel Ortega, donde ha pedido refugio y es perseguido por diferentes delitos en el país, acusado de haberse robado más de 300 millones de dólares en gastos que incluían compras en Chanel en Miami, vestidos para su esposa y lujos para su amante, que es su actual esposa. Es decir, ese es el panorama en el que Bukele aparece en la alcaldía de un pequeño municipio. En gran medida, Bukele es el resultado del desencanto de una población por una clase política que les saqueó a manos llenas durante más de 2 décadas. Y eso todavía va a perdurar más. Bukele, en la actualidad, aún le basta su eslogan, que es decir, yo no soy uno de los mismos de siempre. Bukele no ha tenido que decirnos quién es él. Le ha bastado con decirnos que no es como los otros.
And one more question. I have three more questions, but one more for you now that I have you here. It's related to this. It's a sequel to what we're talking about now. Basically, would you say that El Salvador is following the recipe of the government of Cuba, Nicaragua, and Venezuela to gain political advantage from the pandemic?
Sí, a ver, no sabría comparar con cada uno de esos casos específicos, pero definitivamente el presidente Bukele está utilizando la crisis para consolidar su poder único. Ya había retado antes de la crisis a la Asamblea Legislativa tomándosela con militares para entrar a rezar al Salón Azul donde se ejecutan las plenarias. En la crisis desconoció a la Sala de lo Constitucional, a la máxima corte del país que debe interpretar la Constitución. Bukele dijo que no estaba de acuerdo con la interpretación que la sala hizo sobre la detención de personas que supuestamente violan la cuarentena. Voy a ser breve. Lo que la sala dijo es imposible que convirtamos a los soldados y policías en jueces y que cada militar decida quién violó la cuarentena y lo envíe a un centro de detención. Tiene que haber regulaciones estipuladas en la ley. Bueno, a Bukele no le pareció eso y a día de hoy mucha gente ha muerto tras salir de esos centros de cuarentena. Es decir, Bukele es un presidente que de febrero a día de hoy ha desconocido a la Asamblea Legislativa y luego a la Corte Suprema de Justicia, es decir, los otros dos poderes del Estado. La respuesta es sí, Bukele prefiere gobernar en algunos momentos como si fuera un rey y sus tweets fueran un edicto real.
This is all very familiar to us in our context as well. Thank you so much. And I would like to, basically we have 5 more minutes. I just would like to open the floor to all the panelists for final remarks, comments. Yes.
Well,
yes, Miguel, and we need to be brief. Go ahead.
Well, just briefly, I just want to thank you, Cesar, for organizing this meeting. It has been a great experience. Thank you also to all the panelists for these wonderful talks. I have learned a lot about the COVID situation in other Latin American countries, and I'm certain we are in this together. No? Thank you.
Thank you, Miguel. Ambassador Manuel?
Thank you very much for this great meeting. It's an honor being here, and just shows how diverse we are and how big we are. And yet, with all that diversity, we share so many same difficulties, challenges, and problems. So we got to stick together, work together, and find common solutions. Thank you, and looking forward to our next panel. Thank you.
Yes, I think we have more questions than answers now. Does anyone else want to comment?
Cesar, if you allow me, just to join the congratulations about your organizing this panel. It's really being interesting. It's really being helpful. It has taught us a lot. And besides the differences among the different Latin American countries, I think that has been a moment that we can see that there are lots and lots of similarities, that lots of our problems are shared, that lots of the answers that we give to our problems are also shared. So it's really important that we keep on talking among us to reach some more expanded answers to the challenges we are facing now.
And that's exactly my sense, Ruben, that we need to talk about that and just basically supporting other communities and just sharing our perspectives. There are other questions about the notion of race and other topics, but I think I'm going to stop here right now. I just would like to really thank each of you, the panelists, for taking the time to share your knowledge, your expertise, your facts, the time that it took you to prepare this presentation, your cooperation, and how fast you were in responding and in accepting to be part of this panel. So thank you very much. And before we close, I would like to thank the following people. I would like to thank the Hamilton Lugar School of Global and International Studies for taking care of the logistics of this webinar. This is the Zoom platform, but there is more than that. So I would like to thank in particular Janae Cummins, Tyler Machino, and others for really putting this together, for coordinating this with the panelists and with myself, for all the support from Assistant Dean John Hansen and Lee Feinstein. Thank you all very much. I would also like to express my gratitude to my staff for the Center for Latin American and Caribbean Studies, Catherine Cashman and Sonia Manriquez. They were the ones who really helped me put this together, not only the announcement, but the website and the expertise. So thank you all for making this happen. And unfortunately, we didn't have time to answer all these questions, but maybe we can do it in the future. And just so you know, this presentation will be recorded and made available for the public. So expect an email about this. Thank you, stay safe, and best of luck for the summer. Goodbye, and thank you all the participants in the audience.